And from the global report back in Nigeria, where last week the Secretary to the Government of the Federation and Chairman of the PTF announced the transitioning of the Presidential Task Force to the Presidential Steering Committee. What does this mean? Joining us from Abuja studio is Dr. Mukta Mohammed, National Incident Manager, former PTF, now PSC, Presidential Steering Committee on COVID-19. Thank you for joining us on the program.
Thank you for having me, Millicent. Good evening.
Good evening. So what exactly does that mean, the PTF's transition to the PSC? And also, in view of all of these changes, we're seeing some state governors who are relaxing restrictions, events, large gatherings. Can we say that we've passed the critical, most challenging moments of the pandemic?
Thank you, Millicent. If you recall, Mr. President had extended the tenure of the Presidential Task Force from end of December to March 31st. But after this extension, there was a careful review of where we are. And the President approved that the PTF transitions into the Presidential Steering Committee. What this means is not that we are over, the most urgent phase yet. But it means that we are moving towards a more sustainable response. If you recall, the PTF was the emergency, body that involves both policy as well as operations, of the COVID-19 response in the country. So this transitioning, is a move towards sustaining the effort, pushing more responsibility to the ministries involved, to the agencies, particularly NCDC, primary health care, and also, other line ministries that are involved in the PTF. In terms of the terms of reference, nothing has changed. In terms of the structure or the composition of the PTF still remains the composition of the Presidential Steering Committee. So it's just the operations that have been modified, and this does not mean completely that we are relaxing from the emergency mode, but rather we are also just trying to move towards a more sustainable response in the country, as well as to encourage states to take responsibility and also to utilize domestic resources in the response.
All right, Dr. Mohammed, today African leaders, health experts are meeting on vaccination production in Africa, and Nigeria also received its share from COVAX. But a lot of people are wondering, when is the next vaccine on COVID-19 coming? When is the next supply expected in the country?
Well, that is really the big elephant in the room. We've had negotiations at country level through the multinational bodies, that is the COVAX facility, as well as the African Union facility, which is AVAT. However, because of the increased global demand and this vaccine nationalism that is going on, such plans are no longer sacrosanct as we had them before. But we'll continue to make the effort and make sure that Nigeria gets its own fair share of these vaccines. So outside getting these vaccines through these bodies, we're also making some bilateral arrangement with the companies, the manufacturers of these vaccines, as well as the countries where these vaccines are produced.
So at the moment, you can't say a particular date, a month where we would expect the next batch of vaccines?
We have working dates that we are discussing with the manufacturers, but we are not coming out public with these dates because we know, just like in the past, these dates may be shifted because of the what I mentioned, the current demand, global demand, and also the dearth of supply of the vaccines.
Just before we let you go, as we wrap up the program, one final question, and this is for the batch giving to states. What is the order? Is there an order that if they reach half, they would need to preserve the rest so that it completes the 2 doses required for the Oxford-AstraZeneca vaccine?
So we are still discussing that issue. For now, we want to be sure that the vaccines are secured for people who have received their first doses. We are aware that recommendations have been made to states that if they reach this 50%, they can pause with the vaccine. However, we still consider very critical the frontline healthcare workers who have not yet accessed these vaccines, and they are priority. And regardless of whatever recommendations have been given, this group should be vaccinated anytime they turn up. We are also aware of other exigent circumstances that warrant the provision of these vaccines at the state level. Like I said earlier on, our effort is more towards getting the vaccines into the country than halting the vaccine program itself. So we'll do all the best. We'll put all our effort to ensure that we get these vaccines into the country as soon as possible.
We'd like to thank you, Dr. Mukhtar Mohammed, National Incident Manager, PSC, Presidential Steering Committee on COVID-19. Thank you for joining us on the program.
Thank you very much. Nice to have me.